Hey everybody, welcome to BFR Tuesday. I'm your host, Ed Cara, out of Dallas, Texas, in my clinic, Body Lounge, Park Cities. I have shared with you what I'm going to talk about today, which is tendon repair using BFR. So a new study came out last week or the week before, and what it demonstrated was that BFR with light intensity was comparable morphologically to and strength-wise to high intensity without BFR, which would be very fascinating because in the past what we've seen, there's only one other study really that looked at this. And because of that original study, we've gone away from using BFR for tendons, not away from it, but not using it nearly as much and using more BFR up to the point where people can start to load them at 70% 1 rep max and then finishing up with high intensity, which is usually the goal anyway. Like usually we just use BFR intermittently until people can tolerate high loads in the rehab setting. This study was a little bit different because it went on for 14 weeks. So what I would do is download, you should be able to see the download of that Centner study. So I made that available to you in full text. So why don't you click on that, download that, and what I'm going to do then is I'm going to switch over and go to this study so we can chat about it. All right, so here is this Centner study. You should have been able to download this. And this just dropped, right? So that's the amazing thing right now about BFR is we're getting all these new studies coming out. And, this is going to need to be validated because it's only been done once. It's the first time these findings have been shown. But I'm going to go through this with you. And so that way we can kind of chat about it. All right, so I highlighted some things in here. This is not in your because I don't like to highlight things for people, but I highlighted this just to kind of do as a call out. So so there was a recent meta-analysis, this reference number 11. Training loads greater than 70% 1 rep max superior in promoting optimal adaptive responses in mechanical stiffness and material, Young's modulus. Young's modulus, or the Young modulus, it's a mechanical property that measures the stiffness of a solid material. So in this case, we're talking about tendons, and it defines the relationship between stress, force per unit area, and strain, proportional deformation, or the ability for it to deform, in a material in the linear elasticity regime. Okay, so we're looking at this mechanical stiffness and material tendon properties compared with low load training. And then with regards to the magnitude of these adaptations, significant increases of 20 to 40% in tendon stiffness, as well as changes in tendon hypertrophy of about 3 to 10% were observed. Again, this is with 70% 1 rep max. So this is what we're comparing things against. And so what we want to see now is, compared to this high intensity, and this is a meta-analysis, so it's one of the highest ways for us to look at research, can we find something that allows us to not load so much yet still get the same response? So their hypothesis was that the stress and strain being about 1/3 of conventional high load resistance exercise, meaning 20% 1 rep max, during low load BFR, again, low load is defined as 20 to 35% 1 rep max. High load is defined as 65 to 90% 1 rep max. And 35 to 65 is moderate load of 1 rep max, 35 to 65%. So they hypothesized that low load BFR, 20% 1 rep max, would not be sufficient to elicit adaptations in mechanical, morphological, as well as material properties of the Achilles tendon. Okay, so what they did is they took 55 healthy men between the ages of 18 and 40 years. So one of the limitations of the study is we're only seeing this in young, healthy men. We're not sure what happens in women, adolescents. But we can assume that if it's healthy young between 18 and 40, that we're probably going to get similar responses even with older, but we probably are going to want to increase protein intake in older individuals to make sure that they're getting enough protein. So, and enough protein, I would define in an elderly person as 1.6 grams per kilogram of body weight. That should be plenty. Okay. What they have found before is greater than 12 weeks has previously been suggested to efficiently induce tendon adaptive responses. So they did this 3 times a week for 14 weeks. And they had a one day break in between. And this is what I typically do with my patients when we're loading it for plantar fasciitis, Achilles tendinopathy. Any of these, I typically will only have them do home exercise every other day. The other thing that I think throws a wrench into this is a lot of my people are still active. They're still running. They're still doing other things. So I've got to play around with loads to make sure that we're not over stressing tissue. So the high load protocol, they separated those 54, 55 people into 3 different groups: high load, and then they also did low load with BFR, and then there was a control group. Now, what they didn't control would have been just low load, which I would have liked to see, but they would have needed a lot more people. They did a very typical protocol: low load, 20% 1 rep max. But I think what they did interestingly, and I think that we need to pay attention to, is being progressively increased by 5% every 4 weeks until 35% 1 rep max in the last 2 weeks were reached. So that might have been one of the reasons that they did this for 14 weeks, to make sure that they could get a little improvement. And this is important because 3 or 4 weeks into this, we would expect increase in strength. So now you're not at 20% 1 rep max if you're still using the same loads you did on day 1. You have to reevaluate 1 rep max every 4 weeks in order to make sure that you're still stressing tissue at high intensities. And when I mean high intensities in this, I'm saying still within that 20 to 35% 1 rep max, but if their 1 rep max went up, your 20% should be increased as well. Okay, so they use a 12 centimeter wide pneumatic nylon tourniquet. What that means is that it's wide. Anything greater than 5 centimeters is considered wide, and it's pneumatic, meaning it's inflated. Before each training session, they got arterial occlusion pressure, or what we call LOP, limb occlusion pressure, and they did it in a standing position. This was very smart. So they matched the position of exercise with the LOP, which I think is necessary. The cuff was gradually increased until arterial pressure, okay, blah, blah, blah. They only trained at 50%. Now, I think that this is kind of interesting because anecdotally in my clinic, I have found that higher pressures have been better. Now, I have not been training people for 14 weeks, especially 3 times a week. So there was another study looking and comparing, 50% might be enough for the lower extremity. I'm not sure. I'm still going to stick with my 60 to 80% 1 rep or a 60 to 80% LOP in the lower extremity right now. But I'm keeping an eye on this because if we still see more and more studies that at 50 or 60%, this is much more comfortable for a patient. And what it might mean is that we just need to get people tired. And that's what I've been saying for a long time, is that we just need to get people tired. This number is not necessarily that important. The weight is not necessarily important. We just got to get people tired. They did a 60-second interset rest period. And then between 2 exercises, the cuff was deflated. They did 2 exercises, straight-legged calf raise, and they also did bent leg calf raise. Straight leg to hit the gastrocnemius, bent leg to get primarily the soleus. 1 rep max was done every 4 weeks. And then they measured a bunch of things. So we'll get to the summary just because you can always reread this. So Achilles tendon cross-sectional area increased. Stiffness increased. properties increased, cross-sectional area of the calf increased, maximum voluntary torque increased. It increased both in the high intensity group, and it also increased in the BFR and low intensity group. So this was the first study that evaluated the effects of low load BFR training on functional and structural Achilles tendon properties. Overall findings revealed that despite a much smaller training load, remember 20 to 35% 1 rep max, low load BFR caused comparable adaptations in Achilles tendon cross-sectional area and mechanical properties, as well as in the muscle mass and strength than high load. Typically, morphological changes at the tendon level have been reported to occur at resulting long-term or habitual loading. So you can always look up some of these studies to look closer. And it needs at least 9 to 12 weeks, it looks like, with heavy load. So high load and low load BFR in this study looked to be very similar. A previous study, Kubo et al., they looked at cross-sectional area, but there was a little bit of a difference. And I think the difference was Kubo didn't increase the loads over time. And so they only stayed at 20% 1 rep max, so it might have not been enough intensity. Another study looked at just 2 weeks, and there was no significant changes in tendon thickness. So we probably just need more time. Looks like we need probably 9 to 14 weeks, something like that, to expect change. You can continue to read through this. From a mechanical or a tension standpoint, they're suggesting that strain and stress are not the only factors influencing mechanical tendon adaptations, just like we don't think it is in the muscle. Number of loading cycles and or concurrent tissue hypoxia might mediate the response. So there's something else going on here that we're not exactly sure besides tendon loading. Again, we do want to get people to high intensity loading when we can, but it would be safe in injured athletes or injured people to do not heavy first, so light loads. Okay, so read through this study. I think this creates some conflict, which is good. It gets us thinking a little bit more about what we're doing and kind of what's happening. I didn't even see these graphs, which is cool. Tendon stiffness, high load, low load, BFR, control. Tendon cross-sectional area. Tendon cross-sectional area. This is cool. Control group, no change, which is what we would expect. Actually would have expected over 14, maybe a little decrease. Here we get this bump and increase. It's very similar to high intensity load. God, that's cool. I'm taking a screenshot of that. I'm going to use that because I love that. All right. Let's look at this. Yeah, see, these were young men. All right. Well, we need to repeat this study in injured people. We need to repeat this study in other populations. But this is very, very promising. So I'm going to get out of this. Stop sharing my screen. Any questions? Any questions at all? So I guess the question really becomes, how does this influence my thinking around tendons? Instead of just using BFR in the early stages, I might be able to use this throughout and do it in combination with patients' home exercise programs. So I might only need to do BFR 2 or 3 days a week, and then the other days, I guess it really just depends on what you're trying to accomplish and what the patient is willing to do. I think with my patient base, I would be able to get them in probably twice a week, and they'd have to do home exercise once a week. 14 weeks would be a long time considering I'm cash-based only. I don't know. It's very interesting. But it is making me think differently about what causes tendon adaptation, especially for my lateral epicondylitis and my medial epicondylitis and Achilles tendinopathy and plantar fasciitis. And I think I have to set that expectation a little bit better with patients that it's going to be a battle. It's going to be, I used to say 8 to 12 weeks. Maybe it's more like 12 to 14 weeks based on this literature and the references that they provided. I got to take a closer look at those. All right. So what else? Any questions? If you have any questions, just put them in this put them in this little chat bubble. If there are no questions, I'm going to continue taking my lunch break. Got patients the rest of the day. I hope this has been helpful. I'm going to put the link below for my YouTube to this study, so that way people can download it. Please subscribe. It really helps me out. And also share and let people know that I'm talking about BFR stuff every week. All right. Thanks so much. Be well.